So why do we need this panel? As the minister was speaking, it made me think of an African proverb, as they say it, that says, you educate a man, you educate an individual. You educate a woman, you educate a nation or a family. And for the work that I do, I once questioned myself, why do we say that? Why do we say we educate a woman? And then I did a lot of research on it, like literally researched it. Where did it come from? And it came from the fact that it was a proverb because they had realized that most of the time men have education opportunities and women don't have. But the few women who were educated made sure that they educate the whole nation. So there was a source for this particular word. And I think this highly esteemed panel of mine, with the work that they do for women and girls, is going to cover all that. So today we are talking activating the levers to unleash women's economic empowerment in Africa. The panel will have two distinct yet interrelated levers to women's economic equity in Africa. The first in securing funding for women, and the second in health. My first question will be posed to Jackie. And the question is around, if maybe I should give a panel a minute to introduce themselves and what they do before I go into asking questions. It's just a minute. Just what you do.
Thank you very much. My name, as already introduced, is Nonkululeko, Prudence Ngwenya. I am the director at the African Union Commission, and my portfolio, I'm responsible for women, gender, and youth empowerment.
Magda Robal is my name. I'm the president and co-founder of Institute of Global Health and Development. I do a number of things, among which public health and gender.
All right, and I'm Dr. Jacqueline Kitulu. I am from Kenya. I am a practicing family physician, and I chair the board of Rocket Health, a digital health company, amongst sitting on various other health boards as well. And I am an alumnus of the Women Lift Health program, so striving to make women move places in health.
And I'm Ricardo Late. I'm the CEO of the International Digital Health and Artificial Intelligence Research Collaborative, I-DAIR, and also the president of UNITE, the Parliamentarians Network for Global Health, having been a 4-term member of parliament and also a deputy mayor, and in a previous life, physician trained in infectious diseases.
Oh, my first question is to Jackie. Jackie, which regulatory frameworks should countries put in place to ensure that as we take advantage of the convenience provided by digital public infrastructure in delivering healthcare to citizens, we do not breach their human rights?
All right, thank you very much for that. And that I would answer from my background, having sat on our regulatory board for the Kenya Medical Practitioners and Dentists Council, and working on the regulatory frameworks along with the Ministry of Health. There were big issues that we really realized at the time of COVID. Data protection and privacy, critical regulatory part. Implementing comprehensive data protection laws that govern the collection, storage, processing, and sharing of personal health information. Obtaining, within them also the concept of obtaining consent, ensuring data security, and all these ensuring that individuals have control over their data. So data protection and privacy, in Kenya, I'm happy to say we have the Data Protection Act of 2019 is in place and active. The confidentiality and security is another item, part of that has to be looked at, so that we have robust protocols to safeguard the confidentiality and security of healthcare data. Informed consent on its own, and that's a big one because healthcare providers and technology vendors need to obtain informed consent from individuals. We are in health institutions, we collect so much data, which is used for so many things. So we need to be really aware of that. Interoperability and data portability, and I think those need to be mandatory in the health sector, because we are at the point where individuals don't even have access to their own data, and this is because data is kept in silos. The laws and regulations around ethical AI and algorithmic transparency. This is a big area, and I think in all the panels today it has been referred to. And therefore, we have to ensure that the algorithms do not perpetuate bias, discrimination, or violate human rights. Equity and accessibility, again, is another part. There's so much in terms of regulation. I sat on a regulatory board, sorry. But again, we are looking that the initiatives do not exacerbate existing inequalities in access to healthcare. Oversight and governance, and I think yesterday Dr. Kaitesi did mention this, establishing regulatory bodies responsible for overseeing implementation and compliance of digital healthcare services. And then, of course, finally, stakeholder engagement and transparency. I think we need to foster and collaboration and engagement with the various users of the healthcare, the providers themselves, the technology developers, the patient advocacy groups, civil society, so that all these are involved in decision-making processes and provide avenues for public input and feedback. I think those are a few things that we need to look at from the regulatory point of view. Thank you.
Thank you very much. Prudence, with all that Jackie had said about what needs to be done by the government and the officials and regulations, research has still shown that financing for women's health is intrinsically linked to the economic power. Could you share examples of innovative solutions that can be adopted to fast-track this?
Thank you very much. I think I'd like to start a little bit different, by painting the African picture, and I really like what His Excellency said about we need to make sure that whatever solutions we speak to are contextualized to the regional priorities. So first of all, in Africa, we're speaking about over 50% of the population being women. And if we're speaking about young people, we're speaking about 85% of the population being either women or young people. So most young people on the continent are women, and most women are young people, if you see what I mean. So which is why actually the way we even approach these conversations is to really speak to women and young people together. The second thing is that it's an old age adage. A healthy mind is a fit mind, or what, I think you brought another adage, but yeah, a healthy mind is a fit mind. So for us to realize economic empowerment, first of all, we're looking at numbers. If the 85% of the population, or over 50% of the population of the continent is not contributing economically, we're not going to see anything. But also, if their minds are not at a state which allows them to contribute, then we are at a problem. Let me throw in another statistic. Globally, there are about 300 million SMEs, and out of those, I think about 30 million are on the continent, are housed on the continent. And out of that 30 million, at least 80% are owned by women. So which really still drives the point around why economic empowerment is important, and also why women are at the engine of driving the economic empowerment. In terms of example, of course, I think the question was to say what examples exist on the continent. And the starting point is obviously universal health access for everybody. We need to make sure that there's a continuum of health, and women and everybody on the continent, they are able to access it the same way. But specifically, we know that women have specific needs that relate to mental health like men, but also sexual reproductive health and reproductive rights, maternal health, and a lot of other things. So this is then just to make sure that whatever is at the government level in terms of universal health access caters for the specific needs of women. We have some good examples on the continent. Here in Rwanda, we actually have a number of examples of innovative things that are happening. There's a program on mutual health insurance schemes. in Rwanda, which basically provides health insurance to community members, including women. It's a community-based health insurance scheme, and it operates on a sliding fee scale and ensuring that even low-income women have got access to insurance. In Ghana, we've got the National Health Insurance Scheme as well, and that's one of the best examples that you can find on the continent that actually allows various insurance and health insurance and packages to cover maternal health services for women. The government of Kenya from 2006 to 2016 implemented a reproductive health voucher program and provided poor women with subsidized access to public and private health. There's quite a few concessional and health system strengthening in a number of countries, in Botswana, but there's quite a few that are happening. We are not there yet, but there's some that is happening on the continent. Thank you.
Wow. I got so caught up there. It's such a lot. Which brings me to you, Ricardo. I hear what the AU is doing, so I would like to know, with I-DAIR is currently exploring innovations in maternal and child development, which is very specific in India and Kenya. Can you please tell us more about economic health impact of these innovations on the communities we work in, and what can we leverage from these programs to improve maternal health access across Africa?
Well, first of all, thank you for having me here. And I must say, if the proportionality of gender on this panel were the same in political leadership, we wouldn't have to have this panel at all. That deserves it. And so I really think it's important for us to have this discussion, and I-DAIR is working precisely on many of these issues. In the past, it has addressed maternal health, but I would actually like to address, if I may, pivoting to actually a question from Her Excellency the Minister regarding gender-responsive AI, because I think it's such an important question, and we are addressing this issue head-on at I-DAIR, which is, for those that don't know it, a neutral platform, a foundation nonprofit based in Geneva, working in partnership with WHO. And what we are addressing there is understanding that AI, one of the many risks regarding AI, or the fears, is the fact that we may be using unreliable sources of information, and that it may have multiple biases, including gender bias. But there are many more biases there. And as always, the most vulnerable, the less resources parts of the world are always those that will be suffering the most out of the consequences of that. Just looking at the training sets that are used today to fuel artificial intelligence, the representation of sub-Saharan Africa is the least of all of the world. So we are actually generating hypotheses and clinical support decision tools using artificial intelligence for the population of African countries using data from the global north. Well, inevitably, we're going to get mistakes. And when it comes to women, it's the same thing. We're seeing biases of tremendous order. And so one of the ways we have addressed this is to understand that artificial intelligence cannot be assessed as a technology as other technologies have in healthcare. In the past, we have used health technology assessment, for example, to ensure that we get safe drugs on the market, medicines. And we would look at clinical trials, and if they said that those medicines are safe and that they deliver the health outcomes they promise, we approve them and they go into market. When you're looking at an algorithm and using machine learning, the algorithm changes every time you use it. So what you are assessing today changes tomorrow. And so what we are doing is a gender-responsive AI tool, which is also looking on responsible and ethical AI, which develops a machine supervising a machine, if you will, in which we have an AI algorithm that develops a report card saying if the algorithm we are assessing complies with the responsible AI standards, including gender responsiveness. What I'm saying is that we are moving towards an age of hybrid technology assessment and regulation. And these kind of solutions that we are developing will help governments be able to deploy artificial intelligence tools to ensure healthcare through technology is accessible for everyone, but ensuring that the machines detect changes in the algorithm with a red flag in time, in real time, so that humans can intervene before people are actually getting hurt. So at the end, we are using technology to fulfill what we all learn in medical school, which is first do no harm. And I believe that we can actually learn from AI towards building those technologies and to find gender-responsive tools for governments, regulators, and even private corporations developing the technologies to make sure that we make not only a safer world, but also one in which we focus on the North Star, which should be more on health and well-being and less on disease, as most health systems are today.
Thank you very much, Ricardo. I like what you're saying. You know, it's like, I always say we tend to focus on reacting towards the women's problems instead of being proactive, and finally somebody saying AI being proactive to the solutions. Because normally we would say, how do we bring women back? How do we? So we're looking 10 years from now on with what we're talking about.
We're actually developing the technology today. So, you know, you were asking me the European Union, just today, an important piece of regulation regarding AI was passed, the first piece. It's going to take 2 years until it becomes public, which is 2025. But at the speed that we're seeing generative AI evolve, governments, regulators, we have to move much faster, which means that we cannot use traditional lawmaking procedures. We need to create boundaries, what we define as ethical, responsible AI, but then give freedom for the development of the technologies and using these kind of approaches that can keep citizens and societies safer. This is a very challenging time where technologists, in organizations like I-DAIR, of course, as neutral platforms, governments, corporations, we all have to come together and find those common solutions fast, or else we're going to see the Wild West of technology out there. And we know what happens when we give a free leash to to technologists, and sometimes the results may not be the ones we hope for. And so we have this huge obligation in a very fast-paced environment to move fast and make sure that we keep our citizens safe.
Thank you. Magda, how does what Ricardo is talking about, which is like ensuring access to quality tech, in this instance I'll talk about healthcare for women positively impact gender equality? And then if you can cover what women's economic empowerment in Africa, and how should we communicate with policymakers to make sure that investing in women's health and economic issues is promoting universal health care that would lead to long-term economic development? It's a fully packed question.
Thank you. I'll try to unpack it. I would like to thank the organizers for inviting me. This is my third visit to Rwanda in 6 months, so really I'm pleased to be back. I think the political economy of women, investing in women's health, is not as well understood as, for example, investing in women's education. It's straightforward. We understand if we send a girl or a woman to school, we see immediately what it will mean for her, for the family, the communities, the society. It's less well understood how much in terms of economic growth, social development, we will gain by investing in women's health, number one. Number two, women's health, unfortunately, has been confined to its sexual and reproductive health. We invest, rightly so, on maternal health, on reproductive health issues, but women's health is much more than that. There is mental health, there is cardiovascular issues, there's cancer, etc. And all these issues are so much neglected. And women living longer than men, you can imagine how much throughout the life cycle women suffer with issues related to poor health. The third point I would like to mention is the fact that the bias within the healthcare in terms of research on women's health needs, packages for service delivery for women, the bias is such that the medicines, the equipment, the tools that are produced are based on standard men references, and they don't necessarily cater for women. Just a quick example, during the pandemic, the personal protective equipment, this the PPE suits that we have seen around, they are produced based on male standards, and women suffered a lot during the pandemic. They couldn't fit them because the women's body is different. They didn't pay attention. They didn't take care of the fact that women menstruate every single month, and if you are menstruating and you have those suits, well, it is hard for you to change, and we can go on and on and on. To such an extent that because women are less included in research for health, particularly clinical trials phase 1 and early stage of phase 2, most medicines for women are not actually being tested for women. They have a higher percentage of adverse effects. They are more likely to be misdiagnosed. They are more likely to be given the wrong medicine. So we need to go back to basics. And this happens because of gender inequality. And is also gender inequality is a cause and a consequence of all this. We need to include women's health needs that goes beyond sexual and reproductive health, maternal and child health and nutrition, to be providing the right package of services, doing the right research, and providing the financial support they need in order to be economic agents in societies. But when women are healthy, they go to work, they produce for the community, GDP increases, they take care of the children. We know when women borrow, the families thrive because they take care of the children. The caloric intake at home increases when women are working, when they borrow. And the entire society, both from the social and environmental perspective, improves. So these are some of the issues we need to be tackling, and maybe later on I can offer some ideas about how can we do that. Thank you.
Thank you. You forgot to mention menopause.
That's another problem, which is so poorly understood, that women are still struggling with menopause, both for diagnosis and treatment, quote unquote, etc. There is a huge range of issues that are either misdiagnosed, misunderstood, because women's health is poorly researched. And because it's poorly researched, the services and the package that we have to offer are not adequate to address the needs. Yet they are the pillars of society, as we have seen, and we need to urgently address that if we are going to move from where we are and jump to a society that thrives and takes advantage of half of its population. And I think the work that Dr. Ricardo is doing in terms of bringing digital tools. Women are now trading using digital tools, and I think it is going to be much easier to include health literacy through digital means and improve women's health in the continent and around the world. What I want to say also, this is not just an African problem. It is a global problem. Europe, America, you name it. The problem is quite vast.
We have like 15 minutes and in our next round of questions, because we have to give the audience some time to answer questions. I would like to know if you could just, when you wrap up in your answer, make sure that you tell us what is it that's different that we're going to do. Because We've been talking about it over and over and over. I think they went to Beijing, they went there, they went to Tunisia. They're speaking women, women, women. What is it that's different that we're going to do and that your organization is doing to make sure that in the next 16 years or 20 years, and I'm going to start with you, Ricardo, in the next 16 years, you tell us what is it that you are doing that's going to make women's life different? And why should policymakers, healthcare professionals embrace locally designed digital health solutions? What is added value on embracing the solutions that you are bringing? And what's different from what has been done in the past?
And you want me to do this in 1 minute more?
Yeah.
Okay. I can do my best, and I'll say the following: around the UN General Assembly in New York, later in September, there are going to be some high-level meetings. One of which is focusing on universal health coverage. This is a big word, which means ensuring health for all citizens around the world. The problem is, what we are seeing is that many times there's an exporting of these broken health models from the so-called West to regions that do not have access to health today. And so instead of using this opportunity for us to use technology and knowledge to leapfrog health systems to the future, to be less focused on disease, which has only led to more disease and a rise of costs and to unsustainability, we are actually, we could use this opportunity to leapfrog towards a model where we incentivize better health outcomes, better well-being outcomes, and ensuring health reaches everyone. And as was said, young girls, women are always the ones suffering the most. And technology can help us identify.
You have 1 second.
Yeah, 1 second, so sorry. But just to say, technology can also, not only through what I answered first in terms of AI being gender responsive, but also identifying the people, particularly young women and young girls and women, that are being left behind, that are forgotten by the institutional health systems, to make sure that we reach out and ensure that everyone is included. Only then will we have universal health coverage, because only then will we reach every citizen.
Yeah, thank you. Prudence, can you tell us about Wi-Fi? The 100 billion USD for at least 10 million women and youth by 2030. How is this going to unleash women's economic opportunities in Africa?
Thank you very much. I have 1 minute, so I'll try and say it as quick as I can. Again, financing gap for women on the continent is estimated at 42 billion US dollars. So it even starts from there. The second most important thing is how the AU works at a macro level, and the actual action needs to happen at the micro level. So the Women and Youth Financial and Economic Inclusion, Wi-Fi initiative, seeks to bridge the gap between the macro and the micro level by making sure that we build a community of actors in the middle. That is the bridge that actually makes women to have access to financial and economic inclusion. It is a partnership framework. So first of all, it seeks to unlock 100 billion US dollars. I said the gap is 42 billion just for women. So it seeks to unlock 100 billion for African women and young people. The financing gap for 42 is just for women on the continent by the year 2030. The AU does not have 100 billion, but what the AU has, it has the convening power to bring the actors and build these communities and say, let's all deliver for women and young people in the financial inclusion sector. So what it really does is we're using the convening power of the AU to embolden stakeholders to build an ecosystem of efficiencies around financial and economic inclusion for women and young people. The last thing I want to say is that if you are to take anything from the Wi-Fi initiative, it's really our ABCD approach, because that also takes us a little bit away from how the AU traditionally offers services. ABCD, we do advocacy, We do brokerage, we do catalyze action in member states, and we demonstrate and as well as engage partnerships towards the Wi-Fi. So that's what I would want to say because of time. Thank you.
Thank you. Jackie, DPIs, digital public infrastructures. How can such afford healthcare financing, insurance coverages, or microcredit for women-led health in business in Africa?
Okay, I'll just give 2 practical examples.
They must be quick.
Very quick. One, starting with that even these DPS, indeed women must be part of the design, because to meet their needs and to know what it is that they require. So from Rocket Health, one of the ways we are leading to women health access. So using again a mobile platform. We know that those who are insured, and especially, so Rocket Health is based in Uganda, and the population that's insured is very, very small. So where is most of the funding coming from? It's coming from the diaspora, coming from elsewhere, people sending money for people to access health. And using the mobile platforms, money can be sent in to that person. Now, what has Rocket Health done to make sure we're locking that health to that, the money for the health services, is that you provide a mobile health wallet, so that on this wallet, funds can be sent into the wallet. And as a woman, I know I have the money available, and then I can seek services within the same platform. So Rocket Health is an end-to-end solution, providing the consultation services, their lab services, pharmaceutical services. So funds come in and they're locked to that. They cannot be diverted anywhere else, and I can seek healthcare, and healthcare along all the lines of whatever a woman may require. So that's one. The other is, very briefly, what we've done, what the Kenya Red Cross has done in public-private partnership with Safaricom, the largest telco and digital service that we had. For vulnerable girls, young women and girls in the north of Kenya, who are unable to to go to school or dropping out and a whole lot of things. What did we do then? That Kenya Red Cross was able to get funding from the Global Fund, and this funding was used through Safaricom to register these people and to transfer the funds to them. So then again, you're able to transfer funds for education for those young women and girls, for them to seek their healthcare services, as again, using those DPIs to access healthcare.
Okay.
Yes.
We'll be taking questions from the audience. If you can just start going to the mic before Magda answer her questions, which is, it's quite interesting. How can we ensure that women's needs are considered in all aspects of health financing, and how can we spotlight the impact of these investments on sustainable development in Africa?
I think we have been concentrating in fixing women rather than fixing the systems, transforming the systems that keep women in a vicious cycle of inequality and poor health. We need to accelerate research that will give us data to change the narrative, so that we build the investment case for investing in women's health. That's one. Second, we also need to, I like this dialogue, this platform, because more often than not, we are in rooms where it's just public health people talking about health, yet we need a multi-sectoral approach. We need a broad range of stakeholders, because it goes with prevention rather than treatment, like Dr. Batista was saying. Let's focus on good health rather than diseases. We need better housing, we need better environment, better hygiene, sanitation, nutrition, etc., in order to improve women's health. And by doing that, we improve children's health, and the entire society has the intergenerational effect that transfers from one generation to the other. And then the third point is that
Thank you, Magda.
we need a new narrative about women's health. It is right to invest in maternal health, in sexual and reproductive health, but it is also right to go beyond just the biological cycle of women and look into other needs that women has, and that will pay off for many generations to come. Thank you.
Okay, thank you very much. I see you already standing there.
Thank you to the panel.
If you can tell us your name and who you're directing your question to, and if it can be short.
Sure. Thank you to the panel for a very interesting conversation. My name is Karuna Kumar, and I've been working in the space of women's economic empowerment and youth participation with multilateral organizations. My question to you and to the panel is that most of the work in the space of digital health is limited and is not sort of as effective as it should have been, because we are more outcome-oriented rather than process-oriented, which also means that as a result of that, we are seeing women just as beneficiaries and not as partners in action. And what is missing is that there's a lack of an ecosystem, because when we mix digital technologies and health, we are working with two distinctly different ecosystems that have different rules of the game. So how do we work with an ecosystem, decolonize this effort on digital health? And if there are any examples from your experience that have focused more on the process and tried to improve the participation of women in health outcomes. Thank you.
Thank you. I'll take both questions at the same time.
Thanks to the panelists for a very insightful discussion. My name is Fumi. I'm a procurement professional, but I have a background in international relations. I'd like to get your perspective on how we can address religious, cultural, and traditional beliefs in the typical rural African society that appears to limit women's access to healthcare, gender equality, and women empowerment also. Thank you.
Anyone can take the questions. We have 3 minutes, so just be brief.
I think for the last question about cultural, religious, and other norms that society impose on women, preventing them from accessing quality healthcare, it goes with multi-stakeholder engagement, listening to the communities, working with the communities. There is no way we can sort this out from Geneva, New York, or any other capital. We need to come down to where the women are, talk to them, talk to the men. We need men allies to be able to sort out the challenges. And most importantly, I think we need to invest in women. We need to remove the barriers that prevent women from accessing power, from being in political leadership, from being in parliaments, to pass the laws that will change the systems that are barriers to access to healthcare.
Okay, I'll go to the first question about women involvement in designing the processes. The last example I'd given about the cash transfer process, which Kenya Red Cross did along with Safaricom. How did we get to the point of determining that cash transfer would be the solution? It involved community engagement. So these were discussions with the community, discussing with the girls, actually hearing from what is the need. And the need was that, yes, we have so many girls who are vulnerable and they are falling out of school, early pregnancies, early marriages. This is the challenge. So the women said, so how do we solve that? That we need to find a way that keeps them in school. We need to find a way that they can fund their education. So even within the process of saying that the funds would be transferred to these women, young women and girls who are vulnerable, then they were locked. You had processes to lock those funds towards the needs that are required. So you partner with the schools, you partner with the health institutions where they would seek services. But then also we also created mentorship groups, again, which involved women and girls to be mentors, to be supporters of the process, so that it was not devoid. It wasn't someone sitting in Nairobi making a decision, but actually involving the community and using those within the community to be part of designing the processes, so that even when it came to ensuring that you get your monthly cash transfer, there is that support system ensuring that you attended your training, ensuring you went to school, and asking you and pushing you to be part of that process. Thanks.
Yeah, I think because we ran out of time, I'll just close and say, I just want to thank the Indian G20 presidency, because they literally, deliberately put women-led development in the forefront of everything. It's not the first panel I'm sitting in and talking about women-led development. It's an agenda that they really take serious, and to come here and speak about it from different angles, it means women are included in the design. we are accelerating the research, and we are talking as the Global South to make sure that these issues of women's health and economic empowerment are really covered and touched on, and it's not a lip service anymore. Thank you.